Well, hi, everyone. This is Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We are back with another MGMA Member Spotlight podcast. Our guest today is Lisa Stockdale. She's Director of Value-Based Care at Silver Cross Hospital. Lisa, welcome to the show.
Thank you, Daniel. I'm excited to be here.
Well, we're excited to have you. Lisa and I had a chance to catch up. We got to meet each other about a month or so ago, somewhere around that range. And then just offline today, we were talking, and we have similar backgrounds, at least geographically. We realized, wow, we both have a connection to Pell City, Alabama. And if anybody's seen Talladega Nights, this is just over there, Ricky Bobby country. So, Lisa, tell us about Pell City. What can you tell us about that?
Well, I met my husband about 15 years ago, and the majority of the Stockdale crew lives in the Talladega and Pell City area. So I have had the honor of, spending summers and different road trips down to take our kids to meet their family. So Sweet Home Alabama is definitely in my heart and is somewhere we love to be on a regular basis. Just love the country, love the family. Time to connect and time in nature, because there's a lot of that down there for sure.
Yeah, it's beautiful there. And with a name like Stockdale, I didn't realize the Talladega connection. Is there any connection to the auto industry, cars, or anything like that there?
Not that I'm aware of. Actually, his grandparents were farmers and very well known in the area for fruit trees and, just lots of different things they grew, and people would come and purchase from them. So farmland has been handed down through the family. So just that's what I know about the history of that family. We actually just had a huge family reunion a few years ago, and 11 siblings. So each family had its own color T-shirt. So just an amazing experience to get all those folks together in one place.
That is so cool. Yeah. I was telling you offline, Lisa, that I only lived in the Pell City area for about 2 years. I was in my early 30s, I believe, at that point. But I had family, I had friends. People would come crash at our house to stay, and then they would go to the race. So that was really neat. I could have just
time down there. School is closed, as a matter of fact.
So. It's everything shut down. What I should have done, if I was more entrepreneurial, I would have rented out my house for like a week, and charged some exorbitant fine.
For parking or something, yeah.
Exactly. Well, that is so neat that we just found that out about each other here just a minute ago. So I want you to share, if you're okay with it, a little bit more about your background in healthcare. Talk about that healthcare journey, what got you started in it in the first place, and what keeps you in it.
Yeah, it's one of those industries that you have to love, to be here. So, I came from a big family, and really just my parents modeled what a life of service looks like at a very young age. So, raised in community and church, helping others. And we had such a huge family that my aunts and uncles, myself, would be assisting our elders and, taking them to doctor's appointments and cleaning their house. And, I wasn't really sure that's what I was going to get into. I did start my college career in physical therapy, but I learned pretty quickly that I was struggling with the coursework. There's a lot of memorization in clinical and medical, and I kind of like to color outside the lines a little bit. So I moved my studies over to exercise science and physiology. I really just loved sports and loved athletes, training and coaching. So I thought I would land somewhere in that space. Cardiac rehab was an option. So, I was down at Southern Illinois University with my studies. And my last year as a senior, I was coaching, assistant track coach for the throwing team for the Carbondale High School shot put and discus throwers, and really thought that I would end up in that more athlete training trajectory. Shortly after college, I was interviewing for positions, and a friend of mine introduced me to a company at the time, Medical Staffing Network. Wasn't really sure what I was going to do, but began a role there as an account manager, covering the Chicago market, and learned every aspect of healthcare because as an account manager, I had to work with department managers and directors who were attempting to fill vacancies. And you know, I learned how to interview the directors to really understand what their equipment, their needs, what the personality of their department was. So when we were placing candidates there, that we were finding the right fit for them. So that's really was my introduction to healthcare. And I spent 10 years in that organization prior to getting into hospitals. So that was sort of my entry point into healthcare.
Yeah. In researching your background, I see that you've had a multifaceted background in healthcare. You've been sales, strategy, consulting, even digital transformation. I kind of have an idea of what that might be, but I'm not 100% sure. But tell us about that part of the journey where you've just had a hand in so many different aspects of healthcare and what that's been like for you.
Yeah. My first hospital role, I was hired by a chief operating officer. And, there are some people that you meet in your life that really, they're like lightning. They change the trajectory of your life. And she was that for me. I was still young. And I always tell her still to this day, you saw me before I saw myself. And in that role, I was serving another local hospital here in building business back when we were bringing admissions into the hospital, right? And trying to bring as much volume as we could. And I did that through meeting with primary care physicians and really understanding what their needs were. I took that sales background and skill set that I had and brought that over to learning about the primary care setting, what types of specialists and what made it easy for them to refer to their partners. And that I spent several years there at that institution, helping them grow business around gastroenterology and surgical volumes and neuroendovascular. So most of my roles have had a little bit of everything mixed in there, which keeps my interest peaked. After my time there, my boss, my leader at the time, he was moving on to another role, and I was sad to see him go. And he just said, you know what, Lisa, if you can get involved in anything to do with accountable care organizations, I would jump off a cliff and go. And shortly after that, an opportunity with then Advocate Health, now Advocate Atrium Health, popped up, and I did just that, jumped off a cliff, and I went, and I had no idea what I was getting myself into at the time. But how lucky was I to learn value-based care from one of the top 10 ACOs in the country with a huge national footprint, one of the largest clinically integrated networks in the country, really that pay-vider feel. And I just absorbed everything I possibly could in that role for 5 years. And that was a very consultative role because I was coming back into the primary care offices, helping them understand where they had deficiencies in their quality performance and educating them on how some of these programs work. So I kind of joke that I'm the translator from all this insurance jargon to the physicians and into really what actual delivery of healthcare looks like. And it's that, that gap or that valley between the insurance business and the actual physician practice. So that's where I spent 5 years. And when Silver Cross was ending that partnership with Advocate, I decided to stay. I just love this hospital. I love this community, and I really wanted to stay and help them be successful in the future with their next endeavor. So that's what led me with a lot of space to work on the digital transformation. I think we can all remember 4 years ago what COVID felt like, what COVID felt like to healthcare. And here I am 6 months into my new role, and the pandemic is happening. And all I could do was study. I mean, people were not coming in for preventative care. And I just needed to figure out how I could support my teams during this crazy time we were experiencing. And that's what I did. I just studied for a year and just really watched the impact of what people not being able to access their providers was doing, so that I had met a vendor, a friend through a colleague, and, saw the platform that they were building. And I said to myself, I'm going to work with you someday. I don't really know how or when, but I am. And we launched the program in March of 2021 together. And so we're 3 years old together now. And we have just seen some wild success stories with that program, and just really grateful for the partnership, because partners are, what help us be successful. So teams and partners, that's a lot of what I do, is build teamwork amongst a variety of different areas.
Yeah, thank you for sharing that. So I want us to talk about that a little bit more than your work at Silver Cross Hospital. So right now you are the director of value-based care there. If you know the information, give us a little bit of an idea of size and scope of Silver Cross. What can you tell us about it?
Sure. We're a unique place. We're a 316-bed standalone facility. You don't see too many of those these days, but we're thriving. And that's really because the leadership here cares very deeply about the success of this organization and the community that we do serve. So the market share that this hospital holds, as relative to other hospitals in our market, is really significant. So I think it's a testament that patients and consumers want to be here. For me specifically, we manage approximately 70,000 value-based lives across 13 different pay-for-performance, Medicare shared savings, and ACO type of contracts. So we're in a variety of risk, upside-only risk contracts, and, working with our medical groups to improve our outcomes in the ambulatory setting is the primary focus for my area. But the hospital itself has always been very progressive. Even just being a standalone hospital, we've been very successful in our market. So,
yeah. So I wanted to follow up then about some of these transformative models, how you've been transforming models of care to improve health outcomes for those patients. Give us an idea of one, if there's one you want to share, or if you want to talk in general there, but I'd love to know a little bit more about that.
Yeah, well, I would say the one most near and dear to my heart is our remote care management team. That's been a labor of love, and just, again, talk about teamwork, medical group operations, clinical support. We started working on implementing a chronic care management program under the direction of the CMS, CCM, chronic care management reimbursement. And we started engaging our patients with 2 or more chronic conditions that are on Medicare and Medicare Advantage through a bidirectional text-based platform that allows our clinicians to be extremely efficient. So medical assistants and nurses are collaborating together, and each care manager is able to handle approximately 500 patients on a monthly panel. And being able to be part of the team that's built out these, workflows, and, we're redesigning how clinicians are working, which also has my heart happy, because I think we have to figure out ways that we can create additional access for our patients. And it may not look like that traditional office visit, kind of coined the phrase that access, it's not just about appointments. And patients can really find us, during our operating hours. Hey, I've left a message, I haven't heard back, I'm almost out of my medications, and we can really act on those things in real time. And we are starting to study our data because of the Medicare Shared Savings Program. We have access to our claims data, and we're starting to see trends of approximately $1,400 per beneficiary per year savings for patients that are actively participating in this program, and even significantly higher savings for patients that have 1 to 3 interactions with their care managers every week, somewhere in the $2,000 per beneficiary per year. So we're actively looking at, well, how is that happening right now? We definitely see a shift away from Part A. utilization into Part B, which is their primary care setting. But what, conditions and what triggers are really driving that is what we're looking to understand right now. But at a top level, we have seen significant savings for patients that have been participating in this program.
That's incredible. You were telling me that about that $1,400 average savings when we talked a while back.
Yeah.
Talk about how you communicate that with the patients, because that's one of those impediments that we've seen in health equity type issues where some patients who need the care don't go get the care because of the cost. So when you
Right.
can have that good story to tell them, that $1,400 savings or that savings in the 2,000 range, what does that look like? How does that conversation go down?
Well, it's really a testament to my nursing leadership because we've really refined the enrollment process with the patient. So we do a widespread campaign to outreach the patient, enough information to get them to respond back if they're interested. And that's where the action happens. The nurses then jump on the phone. And I know we said texting, but it really is the way I look at the use of the technology is to scale that, that human beings work and make them more efficient. So we still want to act on one of our 7 behaviors is explain and engage, right? So we want to be as transparent to the patient that this is a service that is covered by Medicare. But when you participate in these programs, you do have lower healthcare costs because if you are struggling with something, because you are connected to the care team, we can reach out into the community to find resources. So help you apply for grants if you're unable to afford your medications, or maybe you're having difficulty paying your utility bills or getting food, whatever that barrier is, that's really uncovered through the partnership with their care managers. And it's beyond just the medical care that I believe is really driving a lot of the cost savings because we can free up some of the other barriers they may have, which then allows them to, afford those medications and things like that. So it is a challenge still to explain to the patients the importance of the program, but we are just finding nearly 85% engagement rates monthly. That means out of the 2,500 patients that are actively participating, 85% of them have engaged with their care manager to the point where we're able to bill CMS for that 20-minute block of time. And what is in that 20 minutes is a variety of things around their actual clinical care, barriers they're encountering, even with specialists. Can't get an appointment to get a screening done. We step in. Just a variety of things that are really leading to that generation of savings.
Yeah, that is so cool. Now, something else you're involved in, you've done a lot of work with community-based organizations and DEI initiatives. Tell us about that. What kind of role have you played in that? What are some of the projects you've been involved in?
Sure. I think it, was born out of a partnership with our manager of community benefits. Again, I'm really lucky to have some amazing mentors in my life. And her and I just deeply connect on creating equitable access for healthcare, and also that the care feels like home to the patient population that's receiving it. So part of one of the things we're able to do on the platform is translate care plans messages into Spanish. We have hired 50% of our team is bilingual. We have a certified medical translator on the team. So I just started to understand what are some of the barriers for our Hispanic population? What are they struggling with when they try to encounter the healthcare system? And together we've worked on a number of different things, even down to PHQ-9 depression screenings were not translated into Spanish. So we worked on that together, making sure our website was translated, to multiple languages, our call centers. So those are some of the key projects. I was already working on some of these projects through the Connected Care program, which led me to join the DE&I Council because I wanted to make sure that the caregivers that we hire feel supported as patients are engaging with our organization and really find out what their struggles are to provide holistic, personalized care and then get to action, right? What do the caregivers need? And then it's our job to pull those tools and resources together for them.
Yeah. This is the MGMA Member Spotlight podcast. So you're an MGMA member. How did that relationship start? I know you're a very active member, and that's how we first got connected to each other through a colleague of mine and someone who works closely with you. So tell us about that.
Yeah, so the majority of the interaction has been through our medical group operations, our recruitment and strategy folks. Really utilizing your robust data warehouse for, benchmarking and staffing models. And I just got to thinking to myself, is there anything in there that would help me make the case for demonstrating the models that we need, the clinical operations and the models that we need to survive and thrive in value-based care? So I got on the phone and we started chatting about the data. But I know that this has been a longstanding relationship that's significantly supported our medical group in growing and delivering on our mission to expand primary care in our area. So that's how I was brought to the relationship, and it just grew into this conversation today. So.
Yeah. So you've mentioned data several times. So how do you utilize the MGMA data? What are you getting in there looking for? How does it benefit you in your work?
Yeah. So something not too many people think about when they think about population health, credentialing.
Yeah.
And a lot of times I'll see, revenue cycle conversations, and, that's when it shows up in the door. Getting it in the door, right? And getting patients connected to their caregivers. So I'm very bullish on, the proper processes and technology and support for credentialing, because that can actually become a barrier to a patient accessing us. So I was actually doing some research on benchmarking for credentialing and managed care support staff for medical groups. So that's what I've been spending my time digging into so far.
Oh, cool. It's so interesting that you mentioned credentialing. That came out of left field. Wasn't expecting that. However, we hosted an MGMA webinar just last week on credentialing. So
I'm going to have to look for it.
It is now on demand. So I will be putting that in the episode show notes, a direct link to that for everybody. So y'all can go straight to that. And I'll make sure that Lisa has one too. So that is awesome. So one of the other things I wanted to talk to you about before we sign off, I'd love to ask you about your work-life balance. We had a really robust conversation about this both a couple of weeks ago, but also before we went online. You had a very relaxing and fun weekend. You did a lot of cool things. So talk about that, because, working at a hospital, there can be a lot of demands, there can be a lot of challenges, be a lot of stress involved. So how do you kind of disengage from that and have an enjoyable life and do a lot of cool things outside of work?
Yeah. Very intentional work. I think a lot of what led to the digital transformation work and the coaching and education was, sort of facing my own personal health crisis about 13 years ago. I've lost 165 pounds, maintained that. I work, I move my body, but that changes every year. I find as I'm aging that, you get into a habit or a pattern and suddenly it's not working for you anymore. So there's a big chunk of my morning that's for me. And I'm very protective of that time. I get up at about 5 o'clock in the morning, and that's my time to sort of reset for the day, and start off, from a good foot so that I have a successful day for myself and for everyone around me that I'm supporting. It includes meditation, quiet time, my supplements, yoga, lifting weights, whatever I'm feeling that day, but some type of movement, and just making sure I remember to give myself space to take care of those things has really given me the success over the years and the ability and the consistency to stick with it.
Yeah. When you do get up at 5, wow, that's an early awake time. But do you do all of that in the home? Do you have a gym you go to? What's kind of your 5 a.m. workout plan or your habits look like?
Yeah, it's actually at home. My husband and I are on this journey together, and he took the winter and put a gym in the basement for us and really put some things together, which was extremely helpful. I have a couple of different apps that I really enjoy using for yoga. I try to make it as simple as possible. Um, Things that I can find quickly that I don't have to think about or plan for, helpful for me, right?
What
I'm busy.
yoga apps do you use? What,
Asana Rebel is my favorite.
okay. I
And
don't know
there's
that
over
one.
300 workouts, and then I screen share it right on the TV in the living room. So there's no barriers, right? If you have that space and you set that time for yourself, there's a lot of things that you can do at home. And even Silver Cross, surprisingly, him and I also, one of my favorite people, we have an exercise physiologist and a health coach for the hospital for all the employees. And we've launched an app that he can communicate with you, send you workouts, just be that person that can, motivate you to stay on track, provide recipes and things like that. So we're very lucky here that we have an environment and leadership that cares about us personally. So I don't take that lightly, and I really take my time to take advantage of having that space and that time to take care of myself.
Yeah. Last question then. What do you want to leave our listeners with? They're also MGMA members. They're also getting into data dive, going to webinars, doing all the other things, but they're also experiencing a lot of the same challenges that you're experiencing. And what advice would you give them to take an action, something that they can take away from this conversation that can help them as healthcare leaders?
Teamwork. You can't do everything by yourself. And I'm really honored I do have such an amazing team and people that want the same things for our patients. So building relationships with your colleagues and with external folks is really important. It gives you a vantage point outside of your own. And study, study, study. When I started to dig into the payer side, the government, the provider, and the employer, and really understanding all those pillars and how they lead and drive the financial levers in healthcare, if you will, finding the problem is where the solutions are. And if you understand where the fractures and the gaps are in between all of those pillars, that's how you can create new programs and strategically win in your organization. So it's really been the studying, the podcasting. I mean, that's why I'm here today is I spent years listening to clinical leaders and employers and just a variety of different perspectives on the healthcare system. And anyone can do this that's out there. And that's what I really wanted to give today was hope that you can access a lot of information from organizations like MGMA and, a variety of different places where we can find clinical leaders and folks that are already doing this work to know that there's hope and possibility that it can be done.
Yeah. Well, Lisa Stockdale, Director of Value-Based Care at Silver Cross Hospital, thanks for joining us on the MGMA Member Spotlight podcast.
Thank you, Daniel. It was my pleasure.
Yeah, well, that is going to do it for this episode. As Lisa and I were talking about earlier, we will drop several links in the episode show notes. And I just want to say again, if you are an MGMA member and you would like to appear in the spotlight, please send me a note, dwilliams@mgma.com. I'll also put that email address in the episode show notes. So until then, thanks for being an MGMA podcast listener.